Hello everyone, I am Claudia, and along with my colleague Andrea, we will present you our work on accelerating surgical robotic research, a review of 10 years with the DVRK. This work has been a joint effort across different institutions around the world with the aim of summarizing all the research outcomes produced using the DVRK. As many of you might know already, the DVRK is an open research platform that can be characterized by the first generation of the Da Vinci robot, consisting on a master console, a patient side, and controller boxes. The surgeon, or the user as in this case, sits at the console and operates moving the arms inside the patient body. A first legit question that you might ask yourself is, why did we decide to review all this publication? Well, because we are talking of a very extensive community that today counts more than 38 research groups around the world, and also because it's just past its 10th anniversary. And what other better way of celebrating such an active and inspiring community? Personally, I still remember the first time I Googled the DVRK, and I ended up on a situation that was very similar to this one, where I thought that the DVRK community was also producing music. Joke aside, what we realized from a quick Google search of the string Da Vinci Research Kit is that the first hit is directing towards the Intuitive Foundation website, while in case of search of DVRK, the first results is the DVRK wiki page. The aforementioned resources are very useful for understanding the system and its purposes, but what we had the feeling it was missing, it's a resource that could give you a hint on what type of research can be carried out, and also give an idea on how many publications this community is generating. We collected papers from the DVRK wiki page, Google Scholar, and Dimension AI, published between 2012 and 2021. We then filtered and cross-checked them, obtaining a final number of 253 publications.
For describing this huge collection of papers, we decided to classify them according to 5 different research fields. These are respectively, starting from the left, automation, training skill assessment and gesture recognition, system simulation and modeling, hardware implementation and integration, and finally imaging and vision. Naturally, it was hard to define solid boundaries among research fields, which often feature high interconnection. This histogram shows the DVRK community members for which at least one publication was found. Also, you can see different colors that relate to the classification into research fields. The DVRK, as an open platform, allows to read and write all the data flowing in the system. For all the collected papers, we carried out a second allocation based on the data they used. The 5 different data types are images, kinematics and dynamics data, system data, and finally external data from additional connected sensors. To sum up this analysis, the histogram in here shows the percentage of usage of each data type across each research field. The extensive use of images across all the research fields remarks their importance in robotic surgery. Also, the distinct use of kinematics and dynamics data conveys the common operation of robots' haptic interfaces. To conclude, we tried to summarize the research outcomes related to the first decade with the DVRK. We collected more than 250 publications, relying on a massive usage of data that was facilitated by the DVRK. Many of these amazing works involved user studies, and it would be extremely helpful to have a centralized and standardized way to store them for later community use to develop, train, and test algorithms. Also, several simulation environments were developed to specifically address training or automation research. Instead, it would be great to have a joint effort towards the development of a single, fully enabled simulation environment. Thanks for watching.